So next will be association between POAG and metabolic syndrome among the patients attending a tertiary care center. ASWATHI VENUGOPAL.
Good afternoon, sir and all. My topic is association between POAG and metabolic syndrome among the patients attending the tertiary care center. As everyone knows, glaucoma is a leading cause of irreversible visual loss and disability in the world, and it's a multifactorial chronic optic neuropathy characterized by a progressive loss of retinal ganglion cells with subsequent field effect. Now, metabolic syndrome is a cluster of metabolic abnormalities, which include central obesity, hypertension, hypertriglyceridemia, and low levels of HDL cholesterol. It's found that 1/3 of India have metabolic syndrome, and this is the definition of metabolic syndrome by NCEP ATP3 criteria, where it says presence of any 3 or more of these 5 symptoms, where abdominal obesity with a waist circumference more than 102 in men and 88 in women, hypertriglyceridemia, low HDL cholesterol less than 40 in men, less than 50 in women, high blood pressure, systolic more than 130 and diastolic more than 185, high fasting blood glucose level more than 110. Now, there are certain cross-sectional and longitudinal epidemiological studies which have shown association of glaucoma or elevated intraocular pressure with elevated BP or fasting glucose, rather, or sclerotic disease or obesity. So there was a common mechanism linking elevated IOP and to glaucoma to various components of metabolic syndrome. So our aim of the study was to find out association between open-angle glaucoma and metabolic syndrome. And this was a case-controlled study conducted in BMHRC. The ethical committee clearance was taken, and study populations was diagnosed. The criteria was given as by ISGEO. The way the inclusion criteria was IOP more than 21 millimeters with NCT, open-angle chamber, optic disc changes, visual field defect by HFA. The exclusion criteria is trauma, history of ocular surgery, or persons with statins. Now the control group has an inclusion of IOP less than 20, no glaucomatous change, no visual field loss. And exclusion, high myopic, subluxated lens or trauma history of those. We started patients by taking their vision, IOP measurements, visual field text, and an indirect ophthalmoscopic fundus evaluation, along with an arthrometric measurements of waist circumference was taken and height by stereometer and weight for a BIMI measurement. Laboratory investigations include blood samples taken for fasting blood glucose, triglyceride, total cholesterol, HDL and LDL from a fresh sample. So risk factors or any associated factors plays a crucial role in early screening and detection of the disease, with which we can't prevent the incidence of the blindness of glaucoma. Metabolic syndrome is found to have a raised IOP, which is significant risk factor for glaucoma. Also interesting finding noted in the study was systolic and diastolic blood pressure was having a statistically significant relationship of IOP among the female participants of the study. And among the 100 patients in group B, which are the cases, metabolic syndrome was present in 84% of the patients, and it was absent in 16% of the patients. And among the 100 patients in the group C, which are the controls, metabolic syndrome was present only in 22% and absent in 78%. Hence, with which we can conclude that metabolic syndrome is associated, and future physicians can consider for a glaucoma screening in those patients. Thank you, sir.
Nice. You heard on one thing only, then you will be in time totally. The features जो आप उसके दिखा रहे हैं ना बात के कि नहीं देखना है, जो कंट्रोल ग्रुप को आप लेके चलती पूरा वो स्लाइड में आ रहा था बाकी का, तो यू विल कंप्लीट टाइम, नो प्रॉब्लम, नाइसली प्रेजेंटेड.